Well, a warm welcome to this talk. It's very nearly Monday the 7th of February where I am, and it probably will be when you watch this. And as you see, we're back to civilization where we have pens and pieces of paper. Much more satisfactory situation. Now, I want to start off with Europe before we look at the world more generally. And the World Health Organization seems to be coming into line with what we've been saying actually on this channel for some weeks now. But let's have a look at that. I've got actually quite interesting comments. World Health Organization in Europe. Now, this is Hans Klug, WHO regional big boss director or whatever of Europe. And he's saying that Europe, and he's talking about Europe here, is going to soon enter a ceasefire. Ceasefire is the term. Presumably he means a ceasefire with the virus, of course. And a period of tranquility. Well, we'll certainly give that a tick because that sounds excellent. And he says that we're in a plausible endgame at the moment. This is plausible. This could actually add up and make sense. And of course he's talking about the combination of the vaccination immunity and the huge amounts of community herd immunity that have been generated by Omicron recently. Plausible hope for stabilisation and normalisation. Well, we're certainly ready for a bit of normalisation. There's lots more other interesting things in the world that have taken a bit of a side stall at the moment compared to COVID. There's more interesting things you could be doing, more interesting things. Well, I'm not saying it's not interesting, but there's other things that I could be doing as well. That's for sure. And indeed, the world just needs to get back to a kind of normality now. And Europe does appear to be leading the way into this, and this is consistent with what we've been thinking for some time now. This period of higher protection, so he's saying a period of higher protection, should be seen as a ceasefire that could bring us enduring peace. So very military analogies here. So he's saying we have a period of high protection. Now this is going to wane, but the whole point is if we have a period where we're all relatively highly protected and Omicron becomes endemic, then we'll all be reinfected every 6 months, and the immunity should just be continuously renewed, as indeed it is with many other viral infections. So that seems to be what he's saying here, and that could bring us an enduring peace as we are continually reinfected in endemicity, giving rise to long-term immunity. Europe, apparently, European areas had 12 million cases in the past week. Huge amounts of Omicron cases. Now, hospitalisations are up. It is a concern, but as we'll see in a minute, they're not overwhelmed. That is for sure. I mean, it's still a problem because there's so many other patients aren't getting treated, but it's manageable in most places at the moment. It's not saying there's not stress. There is. But it's nothing like as bad as some of the earlier predictions at the start of Omicron. ICUs all over Europe not increasing significantly, and as we've seen in some countries like the UK, they're actually going down. Even with a more virulent variant than Omicron potentially on the horizon. So, okay, there's a possibility of a more virulent, more pathogenic variant on the horizon, he says. The continent was still in a better position and probably could avoid reinstalling the kind of disruptive measures we needed before. Well, what I don't understand here is why we should get a more pathogenic variant coming along. I'm not entirely sure why we should be getting that, because Omicron is so contagious. It's likely to remain dominant unless there's a variant comes along with very extreme immune escape. I don't think that's too likely. So, okay, the WHO European Director here is sort of hedging his bets a bit, which is fair enough, but I think he's being a bit pessimistic there. I'm not expecting a really more severe variant to come along. Certainly not anytime soon. Certainly not in terms of a severely more pathogenic variant. That's not what I'm expecting. Denmark, of course, has basically said time to pack in this pandemic. We're bored of it. No longer a socially critical disease, they've said. And Italy, Sweden, Switzerland, France moving towards moving to phase out social restrictions. And in the UK, you've got to say they're pretty relaxed at the moment, really. So I think, let's just look at Dr. Tedros's comments here, Director of the World Health Organization, globally, of course. The emergency phase of the pandemic could end this year if 70% of the population of every country is vaccinated and vaccines are more equally distributed. It is dangerous to assume that Omicron will be the last variant or that we are in the end game. So two separate things there, really. He's saying that we need to vaccinate at least 70% of the world, which we haven't done yet. But surely, I would say to Dr. Tedros, surely that's exactly what Omicron is doing for us. As the Ugandan doctor said, Omicron is the vaccine we failed to make. And we've seen evidence that natural immunity is better than vaccine-induced immunity in California and New York. So, hard to quite understand the Director General's thinking there. I don't really quite see what he's getting at. Why would you want to vaccinate a few billion people in poorer countries if they're already enjoying natural immunity from Omicron? Not quite sure about that. If Dr. Tedros wants to come on the channel, of course, he's more than welcome to. We could talk about that. And he says it's dangerous to assume that Omicron will be the last variant or that we are in the end game. Well, disagreeing. Well, the European director is saying we're in the end game in Europe. Yes, there's a lot of still to go, and we'll see an example of that in terms of Russia as well. There's still a lot of hospitalisations and deaths still to come. But it's dangerous to assume Omicron will be the last variant. Well, okay, that's his view. Personally, I think we're going to have Omicron for some time. Of course, you can never say it's the last. Never say never, but I think we're going to have it for some time. Now let's just look at some orientation pictures from Europe here. See where we are. So these are new daily confirmed cases per million people, and this is what we look at quite regularly. Now, New Zealand does really need to decide what it's going to do. Is it going to remain a hermit kingdom forever, or is it going to allow the borders to open? Well, they've said they plan to allow the borders to open with a phased reopening, but I'm not sure Omicron will agree with the concept of a phased reopening, and it will just go everywhere in New Zealand. So I think that's what's going to happen. So if you're in New Zealand, prepare for that and optimise your immune system, as we've said so many times. So still low, but coming up a little bit. So if that goes, if there's community transmission there in New Zealand, that will scoot up, that is for sure. And they will have their Omicron wave. Australia, United States, Ireland, United Kingdom, well, no question there, is there? The cases are coming down really quite nicely in all of those areas. Having said that, of course, the testing is a bit rubbish in the UK at the moment. Australia, the United States, and I'm not sure about Ireland, but the testing could be a lot better. So that's perhaps slightly distorting the picture. But patients in hospital, we know this data is genuine. So the United States hospital patients are coming down, the United Kingdom coming down gradually, Australia coming down gradually, and Ireland coming down gradually. So we know that this hospitalisation data is fully genuine. It doesn't depend on whether we get tests or not, or whether we're not doing PCRs after lateral flows. This is genuine data, and it is remarkably encouraging in all of these places. Can we go to another slide? Daily new confirmed COVID-19 cases per million people. Now, this is a wider European perspective. Now, we are seeing a levelling off or a going down in quite a few places. So this is just the last couple of weeks, this graph, really. But if we look at confirmed cases, well, Denmark certainly levelled off. And, of course, that's despite Denmark ending restrictions, essentially. Israel cases are going down a bit. Then we have in order Netherlands, Portugal, France, Austria, Belgium, Germany, Greece, Romania, Spain, United Kingdom, Ireland, Finland and United States. In that order, I left the United States in there for context. So we can see cases have been very high in Europe but are now going down. Patients in hospital in Europe, well, France is going up. There is a delay here, so quite a few places are still going up. So a lot of places have just pretty well got to the peak now. So hospitalizations are going to still keep going up for a while. Deaths will keep going up for a while after that because of this lag effect that we're so familiar with now. So let's just look at the places in order anyway. France most hospitalised, then Belgium, Israel, United States, Spain, Portugal, United Kingdom, Austria, Denmark, Ireland, Finland and Netherlands remaining very low on hospitalisations. Share of people who've received at least one dose of COVID vaccine, well, of course, pretty well everywhere now. And many have received 2 doses and many have received 3 doses. Romania, though, as we saw, just over the 40% mark, so significantly under-vaccinated. And the vaccine numbers in Russia are roughly similar to this as well. So this is why I'm so concerned about the Romania and the Russian situation, because it is mostly unvaccinated people that are being admitted to hospital. Deaths, well, Greece has got high numbers of deaths. Israel, the numbers of deaths have been increasing despite the fact that in Israel, or is it some way associated with the fact in Israel that they're giving a 4th dose of vaccine? I think quite a bit more to come on that story. I'm not going to comment further because I haven't really researched it fully yet, but interesting. So, yeah, these are deaths, aren't they? So going down. Portugal, Romania, again, Romania. Yeah, we think the records are actually accurate in Romania, as we saw from Daniela yesterday. France, well, in terms of deaths anyway, France, Spain, Denmark, Belgium, United Kingdom, Finland, Ireland, Austria, Germany, Netherlands, in terms of confirmed death trends. Now, I mentioned that I was particularly concerned about Romania and Russia as examples of Eastern countries that are very lowly vaccinated compared to the UK or Europe, for example. So here we see some information from Russia. Moscow, record high cases of 186,000 new cases. I think that's for all of Russia, but Moscow particularly record high new cases. And this is in the context of relatively low testing, so we can say that the cases are definitely higher than that. Omicron is now dominant in Russia, we're pretty sure about that. Currently 18,000 people hospitalised. There's significant pressure on hospitals already. In fact, if we'd said before the start of this pandemic there were significant pressures on Russian hospitals, that would have probably been fairly accurate, at least in a lot of areas away from the cities. Elective work has been postponed, elective surgery has been postponed in many parts of Russia now because of the large inflow of coronavirus patients. And the important thing here is that even with Omicron, in low vaccinated populations, we're still getting substantial hospitalizations, and this will transpose through into some increase in deaths. Low vaccination rates in Russia. President Putin's ruled out a lockdown, and you know what? I think he's probably right, because we can't stop Omicron. We can slow it down, but we can't stop it. But of course, if he was to introduce a large-scale lockdown, the economic consequences for millions of poor people would be potentially catastrophic. So I actually think he's probably right on that one. Omicron can't be stopped. We can't stop Omicron. The Chinese are trying hard. Chinese have still got this zero COVID policy, but it's looking anachronistic, unsustainable. We're right to try and slow it down, but we can't. I don't think we can stop it. Life goes on. Direct quote from President Putin. In this difficult situation, he says. Right, so Viktor Zakharov, this gentleman here, Intelligent Logistics Centre, St. Petersburg University. Now, he's expecting there's going to be 200,000 cases a day on the 22nd of February. So that's what? It's about just over 2 weeks' time, isn't it? 2 weeks' time. That's going to be the peak number of new cases. Why does it matter that you're getting so many peak cases, 200,000 cases a day in Russia? Because a lot of people are going to be sick all at the same time, and taking into account the low vaccination rate, this is potentially ominous. 4 million people simultaneously ill. So hospitals are already very stretched now. At least 50% more people getting ill per day. This means hospitals will be overwhelmed. This means people that will die that would otherwise have been able to survive with often minimal medical intervention. So the worst time for that's coming on the 22nd of February, and Romania and other Eastern European countries could be similar. The Omicron is spreading so quickly that the peak cases could be the 22nd of February. And of course, the hospitalisations will be a week after that into the beginning of March, and the deaths will be into that. So the peak period for hospitalisation in Russia is going to be the beginning of March. And quite a lot of people are going to be dying unnecessarily, I believe, just because of the sheer glut of patients all coming at the same time. This is the problem that we are familiar with. Now, Russia's coronavirus task force has reported 230,000 deaths. State Logistics Agency, Rossat, has reported 681,000 deaths. But the Moscow Times, is quite a nice detailed article. This is the actual article from the Moscow Times directly. Nearly 1 million excess deaths by the end of 2021. So of these, which is the most reliable? Well, we've said many times, and we've looked at the UK where it's about 150,000 excess deaths. The excess deaths is probably the most accurate indicator. So this means that per capita, way probably double or treble, we'll have to work that out, more people are going to die in Russia than the United States. It's going to have probably the highest death rate of any advanced or more advanced country, in fact probably of any country. If it's 1 million excess deaths compared to their population, Russia is going to do badly, and Romania probably as well. We already know that death rates are high in Romania, and other Eastern European countries could also do poorly. So I'm just going to carry on a little bit about Romania now, after Daniela's talk yesterday. This is from a cardiologist in Romania. Now, I know who he is, but I'm not going to name him. I agree with Daniela about the political healthcare infrastructure. No new hospitals have been built since the fall of communism in 1989. They've built no new hospitals since then. Quite incredible. People are listening to medical recommendations, so that's good. When they can get medical help, people are accepting that. According to this cardiologist, the death rate is high because of the death rate is higher because of lack of competence of doctors, in part because the health system is state-owned and corrupted. Well, we're not a political channel, but when politics like this blatantly penetrates into people's lives' well-being and matters of life and death, then it does have to become concerning, because we can't ignore these factors. For example, almost no one is employed without knowing someone in the system, or without being in a political party or paying a lot of money. So if you want a good job, it looks like you've got to know someone in the system, be in a particular political party, or pay a bribe. This is not the way that health services should run. but also because people here don't go to the doctor early and they don't prevent disease. So we need much more focus on preventative disease in Romania, and people going earlier to seek medical advice. COVID admissions, a sizable proportion didn't even know they had high blood pressure or diabetes. So this doctor's been looking after COVID patients directly. Patients have been admitted with COVID, and then he finds out they were hypertensive or diabetic. And of course, these things are predisposed to the more severe presentation of the COVID. But these things hadn't been diagnosed. And these are iceberg conditions. Diabetes and hypertension are very common. And often very, very undiagnosed, and because of the lack of the proactive approach to healthcare in Romania, these go on undetected. And it's not just Romania, of course. These are iceberg conditions all over the world. It just depends how much of the iceberg is underwater. And known cases, diabetes wasn't optimally managed. So known cases of hypertension and diabetes, they weren't optimally managed. So the key thing is with these diseases, with hypertension and diabetes, is not whether you have it or not, but how well it's managed. If it's badly managed, you're more prone to severe disease. And as a result of this, sadly, this doctor's seen a lot of people die of COVID. And if it wasn't for this disease, people would have lived longer. In other words, they are dying from COVID. They are not dying with COVID. They would still be with us had it not been for COVID, unfortunately, combined with the untreated comorbidities. The political system is indeed highly corrupted, and that's why also the police are doing a very poor job. Also, the judicial system is not up to standard. I would also emigrate in the near future. So he's hoping to emigrate in the near future. As for returning, what's the point when you, as a doctor, and this guy's not just a doctor, he's also a cardiologist, cannot find a job in the public healthcare system because you're not politically involved? So there we go. I'm not picking on Romania, it's just a country I've worked in a little bit, and illustrates the problems that are common in this world. Now, I'm just going to do a little bit of feedback now before we finish on the fallout. I think you can only call it fallout really, from the Johns Hopkins economic study that we looked at. I think it was just yesterday we looked at that. Was it yesterday morning we looked at that? Showing that lockdowns were basically ineffective and a waste of time. I grossly simplify. But they were saying that lockdowns didn't prevent deaths, basically is what they were saying. A lot have come back on that article. We have looked at some feedback on it already. But Steve's saying, studies in applied economics, it's a working paper, it's a preprint series, so it's not peer-reviewed. And it's studies in applied economics, not to be confused with any other journal with a similar name about applied economics. It's not the same thing. So it's a preprint. It needs thoroughly peer-reviewed. That Steve informs us. States with more cases and so potentially more deaths will tend to have more restrictive lockdowns. Well, that's true. That's true. This paper doesn't address the real question. Would there have been even more deaths without the lockdowns? That is the question it doesn't really answer. I agree. So states with more cases and so potentially more deaths will tend to have more restrictive lockdowns. So what is cause and what effect is what Steve's saying there. And Barry in the United States as well. I'm afraid that I have a rather jaundiced view of economics being described as a science. Barry's being very cynical here. But it does give some argument. You only have to look at how the Fed has handled the economy since 2008. We're about to pay for that economic science, and I think he's probably being a little satirical there when he says science. So our economists somewhat stepping out of their domain of excellence. It is open to question. Okay, so there we are. Situation in Europe. much better in Western Europe already. Hospitalisations going down more gradually, intensive care unit admissions going down. They will continue to go down. Hospital admissions will continue to go down because the cases are going down. Deaths will continue to go down in Europe, and I believe we're going to enter a period of endemicity fairly soon. Tim Spector reckons the cases are going to go down and be really quite low by the start of summer, if I can summarise very crudely what Tim Spector was saying as we reviewed what he was saying the other day. Eastern Europe, with lower levels of vaccination, is going to pay a much higher price in terms of hospitalisation and deaths. And a lot of suffering is going to come in those countries over the next few weeks before Omicron will deliver endemicity there and herd immunity eventually. But because they're not protected by the vaccines while that process happens. See, I think I'm quite a good example of this, really. I mean, I've had 3 doses of vaccine, and despite testing myself quite often, I've just never tested positive. So I can only assume that I'm being exposed to Omicron as I go about my daily life now. But I'm not getting sick because I'm covered by the vaccine. So I'm not covered by the vaccine, so I'm not getting sick, but I'm still being exposed to the Omicron. So I believe I'm getting protection from the Omicron I'm being exposed to, even though it's not bad enough to cause a symptomatic infection that I've been so far able to catch on the lateral flow testing. So this is the same. Whole countries in Europe are getting the herd immunity, I believe, from Omicron, while being protected, but by the temporary immunity afforded by the vaccines. But low vaccine countries in Eastern Europe aren't getting that protection. I know that doesn't fully explain why there's been so little severe illness and death in Africa, as we looked at in Uganda. As Omicron sweeps through there, we can only assume that, well, it's probable, it's a younger demographic, of course, but it's also because they've got cross immunity from other infections, which seems to be really quite fortunate. So is Omicron the factor that's going to deliver herd immunity and endemicity, make it become endemic? Yeah, I think it probably is. And it's just going through this difficult transition period, and then things are going to be dramatically better. Okay, so that's a bit of a review. I'm going to try and get some more information on that Israel situation and the higher death rates there, despite the 4th dose of vaccine, for tomorrow, because that really is quite intriguing. But for now, thank you for watching.